All right, exercising with chronic pain is difficult. And so if you have chronic pain and you are struggling with figuring out how to properly incorporate exercise, this video is going to be for you. I am going to talk through just some different thoughts, some different ideas, different concepts that we have that can hopefully apply to the general person watching this. I obviously don't know what's going on in your exact situation, and so I cannot make a video that will apply to every single person. So I'm going to talk through different things that we think about when working with our patients. We're going to lump them into kind of bigger buckets. So with that, the first thing is that when you are exercising, not all pain is the same. And what I mean by that is sometimes when exercising, you will have an increase in pain, and that increase in pain is okay, it is safe, and it is actually beneficial for you because you're going to be moving tissues, getting blood flow to those tissues, and that can be very helpful to the healing process. However, there are going to be some pains that are not good for you. Those pains could be potentially doing more tissue damage, or it's too aggressive and it's irritating and inflaming an area. And you, as the person watching this, is probably feeling frustrated because how do you know which one is which? Well, if you really need one-on-one help, this is where you're going to need to work with a healthcare professional. Most of the time, this is working with a good physical therapist. Sometimes a good chiropractor can help you with this, or other times it might be a really good naturopathic physician who does incorporate a lot of exercise and hands-on work into their practice. But if you don't have that, then you're going to have to experiment. You're going to have to watch videos like this. You're going to have to figure out what's going to work for you. And so the big thing to step back and look at is when you have an increase in pain with exercise, how long is that increase in pain continuing after the exercise is finished? And so let's say as an example, you've got some back issues and you go and you squat and it's kind of irritating during, and you're like, okay, I feel that, let's see what happens. And the next day you're a train wreck. Your back hurts worse. You've lost range of motion. That's a key thing there. You've lost range of motion and your ability to function in your day has gone down significantly. That is an indication that what you did prior, so in this example, doing the squats, was too much for you. And the pain that you felt was a signal that you're doing too much and you need to scale back. Now, a lot of those times when you have that type of pain during the activity, so during the squat, for example, that pain is generally going to be more intense, and it is usually going to require you to change your form. Meaning that, for example, you can't go as low in the squat as you want to because it's just too painful to do that. And so that's a flag there to say, hey, this was too much. Now, on the other side, you might have a scenario where you do squats, you get a little bit increase in pain during the exercise, doesn't change your form, doesn't change your range of motion, and then you wake up the next day and you're back to your baseline. Guess what? That's good. That means that what you did there was okay, it was safe, and it might actually be beneficial for you to continue doing those types of exercises because over time, that again can help strengthen areas, bring blood flow to the injured tissues, and also, and probably one of the most important things, is desensitize the brain to that area. One of the things that happens with chronic pain is your brain gets more sensitive to things in that area. That's why sometimes just slightly pushing on an area that hurts is actually going to hurt quite a bit than if you just slightly push with the same pressure somewhere else. And so when you are doing exercise, that the brain goes, whoa, wait a minute, we should slow down here. We've got pain, we should not do anything. And you go, wait a minute, this pain feels safe. It is only increased by a point or two, and I am not losing any range of motion. the next day I do not have any change in my activities of daily living, my range of motion, and I'm back to baseline pain, guess what? Doing that continually over time is actually going to desensitize your brain to the signals coming from that area, and you may then have decreased pain because your brain is not oversensitive to that area. And so these are obviously, there's a lot of nuance with all of this, and it is difficult to navigate, but those are just some concepts that I want you to think about, right? Does it change your range of motion or your form? Do you have significantly increased pain the following day? And does it impact your activities of daily living or doing the things that you need to do in your day the following day? If you are having things where you have to do that, then you have to say, okay, that was a little too much, and you have to either do something different or you have to scale back the intensity, whether that's in terms of the number of sets, reps, the weight, the range of motion, all those different things. So big concepts to think about, and I hope this helps somebody.